This is Dr. Dave from Mosaic Life Care, and today's video is on shoulders and how to manage shoulder pain. Shoulder pain is a fairly common condition, but most people don't understand or realize that most shoulders actually originate from the cervical spine. The cervical spine, the nerves from the cervical spine, from the neck, actually control the shoulder. And so most often a shoulder condition is missed because there isn't enough thought given to the upstream impact of the cervical spine and its impact or effect on breaking down the shoulder's ability to cope and adapt. And so the rotator cuff, the four muscles of the rotator cuff, the three heads of the deltoid, which are the big muscles that are the cap muscles over top of the shoulder, these muscles all come from and originate neurologically from the cervical spine, from the lower part of the neck. And so most oftentimes, the correction and the quick correction of shoulder problems to prevent them from becoming frozen is missed because of this. Exercises are usually done to help support the shoulder in its pain and impact, but the consequence of that is that you're just aggravating a problem that doesn't have enough power to control the actions that you're asking it to do. In other videos, we've talked about the fact that nerves control muscles and muscles move joints. And so when you have a muscular problem, you need to have an open awareness as to consider what might be impacting that from that upstream reality, and that's the central nervous system, and that's the spine and the nerve roots that control those muscle groups. So here in the clinic, we use something called applied kinesiology, which is muscle testing, to help us understand and to pinpoint whether it is specifically a shoulder problem or whether it is something coming from the neck. If it's a neck issue, then we start there and we begin to create a foundation of neurological strength. If it's a shoulder issue, we use things like myofascial release, we use a percussor, various different acupuncture awareness tools, such as the MPS tool, which is a microcurrent stimulator tool to understand how to impact shoulders and to make that work to its optimal level. But we'll use these tools to help ensure that we get quick and speedy recovery, and it's actually quite amazing how quick a shoulder can recover when you understand what's going on. The only way to do that is to have a good diagnostic evaluation. So the collarbone, the subclavius muscle groups, the serratus, all of these muscles have to dance together. And here at Mosaic, we have an understanding and awareness that all of them must work together. And you'll see different videos on our website of various different patients that have had shoulder problems that we've been able to get pretty much significant improvement in just a couple visits. So if you have a shoulder condition and you're concerned about it, give us a call at Mosaic and let's see what we can do to try and help you solve that problem as quickly as we possibly can. We'll see you soon.